Hi, I'm Dr. Toby Mayer. I'm very often asked about how I feel about hair transplants for transgender patients or any other patient. Hair transplants are always my last choice, not my first choice. So 50 years ago, more or less, I invented a procedure called the flap procedure. Poor name, but great procedure, because what we're doing, instead of transferring hair blade of grass by blade of grass, we're transferring an entire piece, as is demonstrated in this picture. It's going to come from the side, leaving it hinged in the front. We're going to close this up, and then we're going to take that piece, leaving it hinged there, and remove 2-inch wide strip of bald frontal skin and throw it in the trash. If they have total frontal or frontal to back baldness, if they only need 1 inch, well, we can do that with the irregular trichophytic forehead lift, which I invented also almost 50 years ago. Hair grows through the line, and we'll look at pictures showing that. But why do this? Because it's a little bit more involved, because I use a tissue expander these days. This patient went from that picture to that picture in 1 week. This is 10 years later. He's never had anything further done after 1 flap. Here's the top view of the same patient, from that to that in a week. Because with this procedure, the entire hair is transferred like a large piece of sod, and it grows forever. There's no texture change. It doesn't become wiry and kinky like transplants do. And it's a uniform type of flow of the hair, as well as the best density. You cannot achieve that density with hair transplants. The ones who end up getting transplants are most often patients who've never seen a flap procedure, and somebody says, "Oh, it looks terrible, it doesn't really look that good." So here's a patient who had transplants done, and I said, I can just add more transplants into this area, because otherwise I'm just going to cut them out and throw them in the trash, because they really are useless. And he says, "No, they're all wiry and kinky. They don't look like my natural hair, and I don't think I'm going to get the density that I want." And this is a week after he's had 1 flap. Solid hair. It's not combed over because it is solid. If someone has only crown baldness, you can go from that to that in a week. I just take an entire piece of scalp and I do a flap procedure, cut that out, put in 1 flap. You see a part of the hair, so you can see that it's solid. We're not doing a comb over. Whenever you're going to get hair work done, you want to see what the final picture is going to look like. I describe this procedure and also the irregular trichophytic forehead lift in this textbook. And at that time, there were no other procedures other than hair transplants and the flap procedure, and that's still basically the choice today, other than forehead reduction for patients who only need a small amount of advancement. So if we look at this average patient with male pattern baldness, 1 flap, done. I can't remember what that is, 15, 20 years later. Hair is getting grayer, and today I can tell you it is much grayer than it was then. We can't prevent hair from turning gray, but you see he has not had progression. But should he need a 2nd flap, it's available from the opposite side. The other procedure that I do very often on some patients who have very tight scalps is I make a small incision, put in a tissue expander, a balloon, and the patient can have somebody inject this twice a week with salt water. And when it gets to a certain size, then we can just advance this as far as someone wants without any texture change or having to go through hair transplants and waiting a couple years. If the hair is 10 inches long on the side of the head or the top, whether I'm doing a flap or a tissue advancement with a tissue expander, you'll have a full head of hair immediately. There's no waiting for hair to grow.